The Ed Bernstein Show. Now, here's Ed.
Well, if you don't know what CRPS is now, you will before the end of this show, I guarantee it. With me are my guests, Lily Houle. Lily, hi, welcome. Sitting next to Lily, Michael Sepiol. See how I did that?
Yeah.
You know, when he spells his name on screen, it's Sepiol. Mm-hmm. So, I normally ask the guests, how do you pronounce your name to make sure I get it right? And you were great, man. Just CPO. Forget all the consonants and the other vowels, right? And sitting next to Michael is Glenn Barnes, who's physician, primary care, sports medicine physician, who one time, didn't know him at the time, actually performed or involved in a surgery with my daughter.
Yeah.
Yeah.
Very inspiring at that time, too.
And she's been great ever since.
Yeah.
You did a great job.
Well, good.
But Lily, we talked about CRPS. What exactly is it? What is the acronym?
So it stands for Complex Regional Pain Syndrome.
Complex Regional Pain Syndrome.
Yes.
Okay.
And then it typically starts with an injury or surgery, and then your body attacks that entire limb like an autoimmune disorder.
So instead of healing the injury, your body actually goes in and fights it.
Yeah, so it basically kind of freaks out on that area, and it keeps sending those pain signals, even when that minor injury kind of healed already.
To be honest, I never even heard of it until
Yeah.
I became familiar with what you went through.
Mm-hmm.
And how did this all begin for you?
So it started in December of 2020 at one of my soccer practices right before winter break, and I just slightly overstepped reaching for a ball and immediately kind of was like, something's wrong, hamstring. Kind of felt like I just pulled it, got in the car, told my mom, nothing too crazy, and then took a couple weeks off, came and saw Mike, rehabbed it for a couple weeks, and when I was about a week out, bent over to pick up my 30-pound baby brother with my leg completely locked out and just immediately knew I messed something up with my hamstring again. Things kind of started going a little bit crazy from there. My knee started giving out. My leg would shake completely when I would try to straighten it. So that was kind of the beginning of, weird little signs. I went and saw Dr. Rosenberg through Mike for the first time, and when he went to check my reflexes, I completely kicked him in the shin. Just a couple weird things like that, and then on February 21st of 2021, I was just sitting up at the counter, and my leg kicked out by itself. And then it did it a couple more times in the next 5 minutes, but by the end of the night, it was completely rhythmic, and yeah.
But you had no idea at that time what the diagnosis was.
No, it was just the beginning of everything. Had no idea what it was gonna.
In fact, developing or determining the diagnosis was quite a voyage.
Yeah, so we were immediately, sent to the hospital, and after a week there, came back empty-handed, and, I had no idea how long my search would be for after that,
And Michael, how did you get involved? Explain to me. You are a medical director and athletic trainer, mm-hmm. right? So you work with all kinds of athletes and all kinds of sports, see injuries all the time.
Yeah.
Have you ever seen anything like this?
Honestly, no. I do work for Heat FC in Las Vegas. We're a youth soccer organization, and we're highly competitive, and we're lucky to have sports medicine professional working with our kids. So I handle everything from injury evaluation, treatment, rehabilitation, reconditioning, diagnosis, and referral process for all of our athletes. And when Lily came to me, she did present as a hamstring strain. So we started to recondition her and get her back. And at that point, after she had picked her little brother up, I noticed something was way wrong. Her leg she had an extension lag, which means she couldn't extend her leg. She was walking with a pretty incredible limp. And at that point, we referred her to PT to get some further care. And through then, it became like a journey. Luckily, I have a pretty extensive network of physicians in town, physical therapists, sports medicine professionals, and we were able to kind of start to navigate this channel, but it was extremely difficult. Like Lily said, she was admitted to the hospital. They kind of gave her some information that wasn't helpful at the time for her. And at that point, I was just starting to call up people that I knew in town to try and get her the help that she needed.
Were you getting frustrated not being able to really come up with a diagnosis?
Yeah, sometimes things seem so simple. She had a mechanism of injury, meaning she bent over and felt a pop or a pull in her hamstring, so that would indicate a hamstring strain or a pulled hamstring. So when you start to treat that and things don't improve, it can be a little bit of a struggle, especially when you start to navigate the medical system.
So then you realize, okay, we need some additional medical care here, okay? And Glenn, that's when you got involved.
Yeah.
You do orthopedic work, sports medicine work. You work with the Knights sometimes, right?
Yeah, I work with both the Henderson Silver Knights as well as the Vegas Golden Knights on occasion.
Got to be familiar with injuries, right?
Yeah, and like Mike said, she had such a clear mechanism. Female soccer player overstriding, feels a pull in the hamstring. Those are bread and butter injuries we see so commonly. And to see someone not recover on a very standard timeline, it kind of puts your antennas up that something else might be going on. And then when this twitch started is really when everybody kind of was really lost and really confused. In addition, it was very frightening, for Lily to have this uncontrollable muscle contraction going on in her leg. Mike, I remember Mike calling me. I still remember exactly what he said. He's like, I have a case for you. And every time Mike says that to me, I'm like, all right, this is going to be interesting. This is going to be a challenge. So let's see what you got. And over the course of, I think I worked with Lily for almost a year before we finally made significant headway to get her back to where she wanted to be. But there was a lot of visits, a lot of diving through each individual, finding each individual image study to kind of dissect everything out.
Now on the screen now, you're just showing your leg moving. Those were involuntary movements, right? You had no control over that.
None, yeah.
Were you able to walk?
Barely. My leg completely tremored when I would walk, so I was,
not steady on your legs at all.
Either on crutches or in a wheelchair for almost 9 months. Yeah.
So, and I don't want to minimize this, but but you were in multiple hospitals, multiple opportunities to try to get diagnosed, figure it out, get treated, get a prognosis. What'd you go through in that almost 2-year period?
Yeah, we went to Mayo Clinic, Stanford, UCLA, Phoenix Children's, and you think these major hospitals are gonna figure it out, and you travel all over the country, and just repeatedly left empty-handed. So it was really tough, Now
you were quite the soccer player prior to that. You must have been very frustrated, probably depressed.
Definitely,
right?
Yeah. It's hard. You can't give up. You got to just keep going, and you can't let yourself get too sad. But it's hard, coming back not knowing what your life is going to be every time.
Mm-hmm. Doc, is this common?
It's very under-recognized. So CRPS is a syndrome that is classically seen after surgery. So if you were to read a textbook, that's how it presents. But if you read kind of the finer detail or you dive deeper into the condition, it can really occur after any type of mechanical or physical injury to the body. And so that's why initially, at least, CRPS was really not on anybody's radar because you didn't have a surgery. And that's classically what we see it occurring as, is after a surgery. It's a surgical complication.
Is it common with athletes?
No, and in fact, it's more common amongst the sedentary population, not very common amongst athletes.
Right. So using, being in shape and using your legs and extremities are a good thing.
Yeah, still a good thing. Please continue to exercise and maintain your physical fitness. Yeah.
And you must have been frustrated, Mike. Typically, your physical therapy or surgery, heals most of these kind of athletic injuries, and it wasn't kind of working here, right?
Yeah, and as a clinician, our job is to support the athlete, right? So you can clearly see frustration and fear in Lily, and That's where the team comes through and we support her and put a positive spin on everything. And honestly, through this process, injuries are kind of like putting puzzles together. Every case is different, even if it presents the same way. So when we were looking through what this could possibly be, I started to pull out all these tools in my proverbial toolbox, and we used some electrical stimulation, which is typically used for pain management. But it was pretty interesting because when I put the pads on her, she was able to walk, which is something she wasn't able to do. And I think that's when we thought that it could be something with nerves, which, again, was a pretty big finding, I think.
So you went through this for 2 years. Eventually, what happened? Where was the breakthrough in this?
So we went up to Park City and we heard about somebody going to a sports neurologist. So we just kind of did our own research, found Dr. Kutcher up in Utah, went up to visit him, and, we're kind of like, we're done at this point. We're exhausted, we're tired, let's give it one more shot. We go up to Utah, and they spent the whole day with me. It was about 3 hours of appointments. They told us to go for lunch, come back, had a PT do their own examination, had another doctor come in, do their own examination, and then they put all kind of their own opinions together. And that's when they sat us down at this big conference table and told us, we're almost positive we know what this is, and if it's not this, we have 2 other diagnoses. And slid over a piece of paper that said CRPS, and it was...
Had you ever heard of it?
No. I had heard of it, and I had heard of it when looking at back to the E-stim for spinal cord stimulation. So I was immediately like, something clicked, because the TENS unit, when it was put on my leg or back, it slowed down the tremor. So, I was immediately like, this definitely could be it. And then just flipping through the pages of the, some of the symptoms and everything, the pictures matched, the postures my leg would hold kind of all looked identical.
What were the symptoms?
So my symptoms were obviously the tremor was my main symptoms, but I had a couple weirder things to my skin. I had a lot of weird rashes, bumps, color changes. My leg looked like a different color sometimes kind of than the other leg. Temperature changes. One leg was burning hot while the other was cold, or vice versa. Some weird kind of stuff like that. Yeah. A lot of muscle fasciculations all over my body, not just in my leg.
Were they painful?
Not necessarily, just almost like little twitches, little ripples all over, but yeah.
Just really interfered with all your motor skills.
Yeah, definitely.
Yeah.
Yeah.
Okay, all right, so they diagnose it now as CRPS. What is the treatment?
So there's not one kind of treatment for it. There's a lot of different treatments, but my treatment was simply gabapentin, which I was actually on at the very beginning, just too low of a dose to do anything, but very high doses of gabapentin with titrated physical therapy, yeah.
And you continued at the same time with the physical therapy, where she was doing the medication and physical therapy?
Yeah, Lily would go to a physical therapist at Dignity Health that had a special electrical stimulation unit, which helped activate her muscles, and then she would come out to me 2 to 3 times a week as well on the field. So she was very diligent with her training and her therapy because she was motivated. Lily is resilient, and she's one of the hardest workers I've seen, and it's pretty inspiring to see, someone who we don't know if she's going to be able to walk normal, let alone play again, put the work in to regain some muscle strength, balance, and recondition her to functional movement.
So is it almost like retraining somebody to walk and jog and...
Yeah, I haven't really had to do that before. I have post-surgical cases. You typically see some motor pattern change, meaning like an ACL injury. Someone has to learn how to walk again because they can't fire their quad or there's pain. With Lily, her leg was tremoring for almost 18 months. So it was a big challenge to even get her to heel strike correctly when she's walking, a simple walking pattern. And from there, we worked on just more functional movement-based exercises like picking her knee up right? Just controlling, decelerating walking. It was pretty interesting, but it was a rewarding case to be a part of.
And Dr. Barnes, is there a way to easily diagnose this?
The trick is to keep it on what's called the differential. So when a physician sees a patient, they should be building in their mind a list of things that would likely be the cause of this patient's problem. We call that a differential. So the first key is awareness that CRPS is on the differential, which is why it's so important that Lily is raising awareness of CRPS so that other people in the community can even be aware of it in the first place. Because if you're not aware of it, you're going to miss the diagnosis. So after it's on your list of things you're considering, basically you work through diagnostic tests and imaging, history, and physical exam findings, and you kind of mark things off the list and you head down until something really fits quite well. And in this case, when CRPS was presented, it had checked all of her boxes. And so it was through just really diligent work, consistent follow-up, keeping good records and track of all her history, all her physical exam findings, every last little detail, all her imaging, all her nerve conduction studies, and on and on and on. And Lily can tell you how many things she had done. But just tallying all these things together, putting them together, being a good historian for it, and then matching that to the diagnosis is how this problem is usually diagnosed after everything else is ruled out.
Yeah, it seems like it's ruling out everything else, and you're left with this.
Yeah, because while CRPS is not common, it's also not exceedingly rare, right? So physicians will see this in their careers. So it's important to be aware of it, because if you're not aware of it, it will see you, as we say, but you will not see it.
So the three of you are, have gone through this experience. So what's important now? Are you trying to educate physicians? Are you trying to educate schools? Are you trying to educate other patients? What are you trying to do?
Yeah. Go ahead.
I definitely want to try to spread awareness by doing some speaking engagements. My goal is to speak in front of doctors, hospitals, spread awareness among them, sports teams, because it is sometimes seen in sports injuries, and I think more so overlooked there because, like you said, you don't think an athlete is going to go through such a issue.
Right.
So there's that, and then also speaking in front of schools. Yeah, but.
And on my standpoint, I think that having just medical professionals available is extremely important. I don't know the path that Lily would have went through if I wasn't lucky enough to be a part of this club. It was, I was in the right place at the right time, and I had built some good relationships. So I think putting medical professionals and making them available to all levels of people. Athletic trainers work in multiple settings, like secondary schools, hospitals with sports teams, performing arts, industrial settings. So making them more available for student athletes and the population is important for me.
Is this something they teach in medical school?
Very briefly. Very, very briefly. In fact, if I recall, most of my exposure to the diagnosis of complex regional pain syndrome actually came during my board studying. When I was studying for my family medicine boards is where, I got a question wrong on it one time, and so you dive into it, and okay, what's this thing, and you try to remember it. But, there's no dedicated courses or, hour-long lectures on CRPS or anything like that.
So how do we familiarize physicians with it?
So at least from my standpoint, I'm involved with UNLV's Sports Medicine Fellowship Program as well as their Family Medicine Program. So this is a topic that I brought to the educational curriculum within UNLV to teach our sports medicine fellows and educate the residents that rotate with me. It's very common for a resident or a fellow to rotate with me, and the first thing I do is I pull up an ultrasound I did of Lily's leg, and I go, what's going on here? As I point to the ultrasound, and then I give them the case, and I say, okay, they sit back and go, okay, what's the diagnosis? Yeah. And it stumped every single one so far. And so,
but it won't stump them the next time they see it in real life.
You got it.
Right? I mean, that's the key to this.
You got it.
And what exactly, can you explain to me what you do, Mike? Because it's, You know, when I went to school, we didn't have guys like you.
Yeah. So, you know, traditionally we work in sports settings, right? And we are just medical professionals available to assist with anything. Most oftentimes in the secondary school in Nevada, for instance, and especially in Clark County, we might be the only medical provider some of these student athletes see. And we're present, you know, during competition, practice, before school, after school, for these individuals to come and get treatment and help they need. So what I pride myself on is building relationships. I've met a lot of great medical professionals in the state, and I've tried to network and connect everyone together. I think that's an important piece of this, is this concierge medicine web that we've created as a group. And, you know, I'm looking to unite more of these professionals together and educate the public on what athletic trainers can do. And most importantly, I love helping people. I think that's the biggest piece of this. To be an athletic trainer, you have to be willing to put in hours and help.
So how does the educational component differ, like with an athletic trainer or a physical therapist or a chiropractor?
Great question. So traditionally, athletic training was a 4-year bachelor's program, but we have moved into a direct admit master's program. So for me, for instance, it was 4 years of undergraduate education and 2 years of graduate school. Physical therapy is an undergrad major, and then 3 years of school now to get your doctorate in physical therapy, and chiropractics is, I think, 3 years post.
I actually don't know.
So, but yeah, now it's going to be a 2-year master's program, direct admit, across the country to be an athletic trainer. So undergrad education plus master's education.
Right.
And right now, most athletic trainers have a master's education.
And you, Glenn, you're involved in sports medicine. I mean, that also is a field when I was a young man didn't exist.
Yeah, it's not. It's
Extremely
really
popular
a
now.
growing field
Yeah.
in the last several years. So I did my primary residency in family medicine. So I'm a primary care family medicine physician, and then in addition, I did an extra year in specialty training just in sports, and that's the comprehensive care of the athlete. So that includes just the normal family medicine stuff as it applies to athletes, as well as comprehensive musculoskeletal care. I do not perform surgery. I am not a surgeon. I do some small minor procedures, but no large incisions and operating rooms and things like that. And so I've really grown to love my field the more I practice it. Because as a family medicine doctor, you really get to establish the relationships and get to know people, which is really where the therapeutic relationship lies, is having a good connection with the patient. And then in addition, I personally love being physically active and love optimizing health and performance. And so being able to optimize people from, a primary care standpoint, in addition to giving them the tools and the recovery and the diagnosis or the referrals, whatever they need, in order to continue to be physically active and out in the world, enjoying their life, is just incredibly rewarding. And Lily is like my shining star example of this, to take just this vibrant young lady who is doing amazing things in soccer, to have this devastating complication of injuries and the runaround from many tertiary care centers, and to see her come out the other side and be able to be a part of her journey is probably the highlight of my career so far. It's a fantastic story.
Wow, it's so sweet. You were a top-notch soccer player. 2 years went by. You fought this illness for a couple of years. Recently, a few weeks ago, for the first time, you went back on the field. What was that like?
Pretty incredible. I mean, words can't even describe
Had you given
that.
up you thought that you'd ever be able to play soccer again?
I don't think I ever did. I think Mike
I think
definitely,
you did.
yeah. Mike definitely kept that alive for me.
Mm-hmm.
And, when I didn't think I could, he kind of told me if I wanted to that I was always going to be an option.
Mm-hmm.
And so I decided that I wanted to get myself there, and then I could decide. And once I was finally physically capable, I knew I wanted to play so badly.
Is she cured? I mean, or does she have to worry about this reoccurring?
We cautiously optimistic that she is cured. Yeah.
Okay. And what do you? Okay, now you have a nonprofit you're starting.
Yes.
Right. We'll put that up on the screen, and where somebody can get information. But what is it that you want to accomplish?
Well, first, like you said, I would love to do some speaking engagements and just spread awareness in general, share my story, you know, even if I can help one person, whether it's they see this and, you know, they're trying to get diagnosed or they know somebody or, you know, that kind of thing. And then I'd also like to raise funds to give scholarships to people who can't afford the treatment, because I was lucky enough to have great health insurance, but 30 million Americans don't. And just, it can be really financially challenging. So just donating a scholarship to somebody who can't afford the treatment or can't afford the travel. And then, yeah, I would like to just overall share my story and get the message out there. So
We only have like a minute left, Doctor. What would you tell other physicians when they come across a situation where they just can't figure it out?
Gather a group, put heads together, call your colleagues, call your specialty colleagues and get together. And the other thing I'd really encourage physicians is to trust the patient. Believe the patient, listen to them, sit down and connect with them.
Right. That is great advice. Thank you so much, Glenn, Mike, Lily. Good luck.
thank you.
You want information? www.crpsstrong.com. And we'll see you next week.
My name is George Tice, and I'm a real client of Ed Bernstein. So I was in a really bad car accident, head-on collision. I had to have surgery, and I needed a good attorney. So I immediately thought of Ed. Ed is tenacious, and he knows what he's doing, so he was my best choice. He cares about his clients, and he cares about the results of the case.
The most important decision you can make when hiring a lawyer is choosing the right lawyer for your case. We are that firm.